Jen, you have another question?
Just quickly, when we're doing our hips and props up here, you say your first line maybe is, say a Braxone hypothetically, and then we get 3/4 of the way up. If you've had a break of, say, 3 or 4 years,
I would sometimes reach
can you come back to...
Yes. So it's a very difficult question to answer, and there are a lot of complicated mathematical and genetic analysis. It's like this. I'll give you another example to understand. So let's say the breast cancer is a box of Smarties, a bag of Smarties. Well, I like to give explanations which people can understand. There's no point in talking jargon which my patients can't understand. So let's say the biggest amount of Smarties were blue ones, but there were also red ones, and there are also yellow ones, and then there are also green ones, and then there are also white ones and whatnot, and chocolate brown and whatnot. So you throw a chemo, a Braxane, and the blue ones get killed and wiped off, because a Braxane usually works for most breast cancer, and so the cancer shrinks. So 6 months of Abraxane, you get neuropathy, you get tired and you get fatigued, but when you do the scan, the cancer is shrunk. But there is still some blue left there, but it is not as much. Then, over time, sometimes you are having Abraxane or any chemo, the cancer might actually get worse on chemo. And the reason is these yellow ones, they start to multiply now. So now you know, if you keep on giving the blue one, because the yellow one's targeting, it's not going to work. Remember, our human bodies or human DNA is extremely complicated. It has inbuilt mechanisms, that's the way I think, of dealing with any kind of stress. So if there is a lot of heat, our body will change and adapt to it. If it is dry, it will adapt to it. If you go to a cold, like, just give you an example, I was in Brisbane, went to London, went there in mid-August, and we were all wearing coats and sweaters and whatnot because it was just too cold for us. Next summers and next winters, we weren't wearing any jumpers until November because our body got used to it within 12 months. So similarly, cancer is literally like another organ in the body. It gets used to every stress you throw at it, and there are inbuilt pathways of defense against any stress. And if you try and block this one will grow, and you block this one will grow, and you block this, and over time it will get blocked. Everything will get resistant. That's why the response to treatment decreases over time. So to answer that question, you use a particular type of drug, and traditional teaching is that once the drug becomes resistant, there is very little point in re-challenging it. But over the years, I have treated women, and not it like if you treated 100 women with advanced breast cancer who've never had a taxane with a Braxane, probably 60% will get a shrinkage in their disease. But if all of those 100 women had a Braxane before and you treated them 2 years later, 20% may only have a shrinkage. Because they may still, most of them will probably still have a genetic abnormality or a pathway which is already activated, which causes de novo resistance to that therapy. But in some case, the population, because you have treated it with the blue one, and then you've treated with the yellow one, and then you've treated with the green one, maybe the blue one have started to grow over time. So what happens when you give the therapy against the blue one, then the cancer shrinks again. So in some cases it will work, not in every case.
You talk a couple of years, wouldn't you?
Yes, usually. In general, means there is no lot of data around this, but in general terms, if a therapy gets resistant or a cancer gets worse within 3 months of stopping a therapy, it's literally pointless to go back on that therapy. If it's more than 12 months, we might re-challenge. But a problem with the Braxane is it's a great drug, but a lot of women have neuropathy. And sometimes the neuropathy may not recover, and next time around you're subjecting patients to neuropathy again.
And is that most treatments with Abraxane are weekly, aren't they?
Well, you can have 3 weekly, but we know that weekly is probably more effective and definitely better tolerated. So I prefer to do it weekly because it's better tolerated. 3 weekly, it's like you're getting a bigger dose. It's obviously more convenient for you. You have to come only once every 3 weeks, but you might get more side effects because you're getting a bigger dose. So weekly Abraxane, I find it doesn't cause any allergic reaction, hardly any nausea, rarely any diarrhea. just women I find is hair loss, touch of diarrhea maybe, and feeling tired, and neuropathy. These are the 3-4 most common side effects.